Have you read The Four Agreements? Most of us have, or at least we've heard of it. It's a book by Don Miguel Ruiz, and it talks about 4 agreements. Number 1, be impeccable with your word. And what does that mean? It means be honest. And isn't that important? The first step always starts with being honest. I cannot make any steps forward in my life in a positive way if I'm not being honest. And that includes when I'm talking to patients. I need to be honest with patients. Let's talk about that, an example of how we as doctors treat. But before I do that, let me just cover briefly the other 4 agreements. Number 2 is don't take things personally. Number 3 is don't make assumptions. And number 4 is to do your best. Now, how do these relate to dentistry? Well, being honest, that's a slam dunk. But are most of us honest with our patients? I think a lot of us make assumptions about what the patients are thinking, and we're not being honest with them. We tell them part of the truth. We tell them the truth that we think they'll accept. Well, it's really none of my business to tell a patient what I think they'll accept. My business is to tell them the truth so that they can make the best decision for themselves. And by being honest and being impeccable with my word and doing the best that I can for my patients, guess what? They get the best care because they can take some ownership of what's going to happen in the future. The second one, don't assume, is also very important. I can't assume what my patient wants to do because I am biased. I'm a doctor, I'm a dentist. I know a lot about periodontal disease and rounds and restorations and extractions and bone grafting and connective tissue grafts and orthodontics that patients don't do. So I have a bias probably for dentistry because I do a lot of these procedures. My patients don't know anything about this. So my responsibility is not to make assumptions, to assume, but to give them information. Because by the way, as I'm assuming, guess what the patients are also doing? They're assuming too. They're assuming that I'm going to do what I want to do because I'm a doctor and I'm going to make money doing it, etc. So I try to clear the air by having a very open and honest environment where everything's very open, clear, vulnerable, honest, back and forth talking, and not making any assumptions. The third one, don't take things personally. A lot of us do. I was on a phone call yesterday with somebody in another field, not a doctor. Actually, he was in the finance field, and he was very incompetent. And he was bothering me when I was talking to them, and he was lying to me. He was making assumptions about the financial situation that we're talking about. What it was is not really important, but he's a younger guy. He was 30 years younger than me. He wasn't being impeccable with his word. He was making assumptions, and he was taking things personally. When I said to him, I said, I don't like that way you're talking. I want to talk about this. He made something about money personal. And at the end of the conversation with him, I decided that I wasn't going to use him anymore as in that role that he had. I was going to use the senior person. I didn't think he had the integrity to work with me. So because he took things personally, he made assumptions and he wasn't his word, he lost the business. We often do that in dentistry. How many of you are booked 4 months in advance? How many of you have a 90% case acceptance to comprehensive treatment? Or are you only telling the patient, well, we'll do this 1 crown because that's what the insurance will cover and that's what you think they're going to do, and then maybe we'll do another crown next year, etc. Do we not give the patient all the information because we're violating one of the 4 agreements? And then the 4th one is do your best, which is a slam dunk. Shouldn't you always try to do your best? We were taught that in kindergarten, weren't we? But do we always do our best? Do we always say, well, I got to be out by 5 o'clock. Maybe I better not spend another half hour with that patient. I don't have time with that. But I think it's really important. If you want to improve your practice, if you want to improve your life, read his book. Read the 4 agreements. Study them. I think about them every day. I have a copy in my office. But when an employee comes in and they're complaining about something, I go, are you taking it personally? Are you making an assumption about that patient? Are you doing your best? Are you being your word? Usually, one of the 4 agreements are being violated. So take a look at it. Just my suggestion for today. I hope you have a good day, everybody. Do your best. Don't take things personally. Don't make any assumptions. And always be your word. You'll be the gift to the people you serve.